My name is Stacie Ferguson. I'm a registered nurse. I am here to present to you my Capstone and 5-year plan. Today's date is November 2018. My education includes, in August of 2017, I obtained my Certified Medical Assistant from Kaplan College. This is the beginning of my long career in nursing. In August of 2016, I furthered my education by obtaining my licensed practical nurse through Lamar State College, Port Arthur. And in December of 2017, I obtained my Associate of Applied Science nursing degree through Lamar State College, Port Arthur as well. And in December of 2018, through a long journey, I will obtain my Baccalaureate of Science in Nursing through Lamar University, Beaumont, Texas. I'm here to speak with you regarding the student learning outcomes in the nursing program. The first one that I want to speak with you about is the humanity and society. The learning outcome is practices safe and effective holistic patient-centered care to a variety of patients in multiple settings from a global perspective by incorporating theories and evidence-based findings. You can find this in the undergraduate RN and BSN student handbook. The class that I felt that I learned and achieved this outcome was in Nurse 4540, Nursing Practice Care of Communities. The assignment that I felt the most was the practical and project planning and windshield project, and the discussion, the global health problem. In these, especially the project planning and windshield survey, I was new to the area where I live, which is in Stacie, Texas, and I really didn't know a lot of people, nor did I know the surroundings, what the community had as far as what they could obtain for resources. So getting out into the community and actually speaking with people, I was able to measure what resources were available to them, what were not, and what the community needed as a whole. My husband grew up in Stacie. I did not. I actually grew up in Lumberton, and then prior to that, I was in Port Neches for 10 years. So I was new to this area and the people. But through this project, not only was I able to set out plans and help the community, but I engaged with new people and built lasting friendships. This is actually where I met one of my former professors, and we are friends now. So moving forward, the next one is the lifespan health continuum. The learning outcome here is supports patients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. This again is also found in our handbook. The class that I felt that I obtained this was in the care of communities. Many don't know, but this is my second go-round. I started the BSN program in 2014, and in 2015, after my father had died, I had started care of communities, where I had encountered my first dying patient. This was hard because it was only 5 months after I had lost my father, and facing it was difficult to overcome. But I came back, went through the LVN, went through the RN, and now I'm pursuing my BSN, and I will obtain that next month. But this, I felt like I was able to achieve this through the community-based learning project, as well as the planning and windshield survey. I felt that at this point I met my goal 100%. Now, my community-based service learning, I really had a lot of fun with. I wrote a paper and did a presentation over ASK, which is an organization, Adaptive Sports for Kids, which is very dear to my heart. These are children that come from all walks of life, that are special, to put it. They are children that are autistic, have Down syndromes, suffer with various illnesses that people would normally just overlook. They don't understand that these kids still want to be able to enjoy a life and a childhood, and that's where ASK comes in. ASK has year-round sports for these children and volunteers like myself that teach the kids soccer and basketball and volleyball and karate, and we get to interact with these children and give them a sense of welcoming and life and love. They're able to play with their friends and meet new friends, and we even have buddies, which are kids from high schools that come and interact with the children and share their love of the sport with them as well. I felt that through this I was able to get it out to my fellow classmates as well, and to the program as a whole, because now other people know about this organization, and it's like a snowball effect. From here, they would be able to share that information with other people or other families that may need those resources. And I felt like I met the goal 100%. The next one is Lifespan Health Continuum as well. The learning outcome was evaluates patient-centered care for patients' clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. This I felt I obtained through the comprehensive medical multiple health states. The assignments was the practical reflection and the discussion board. There were plenty of discussions and interactive, and being able to not only make your posts but being able to respond to others as well and carry on the conversation that you generally would not be able to had it not been for this class. One of the discussions that I really enjoyed, because I do work in surgery, pre, intra, and post, was regarding pain management. There was studies that were done with affirmative IV Tylenol, basically being given pre, and it helps the patients carry over for the 18 to 24 hours post, along with their other medication regimens that the doctors prescribe. But this in general really helps, and it's not as bad on the patient. There's fewer side effects. And it was neat to be able to incorporate that not only in my class, but also in my line of work, because there is plenty of physicians that do use the affirmative pre. The next one is rather interesting. This is the evidence-based practice and clinical reasoning. The learning outcome was this synthesizes clinical reasoning and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. I felt that this was mainly obtained in the nursing evidence-based practice. So the assignments was the peer collaboration assignment and the discussion papers. I felt that I met the goal 100% here as well. And one of the critique papers that I had done was a quantitative critique, and it was over hospitalizations due to firearm injuries in children and adolescents. This is a great nursing research topic, because it is a current problem that as a whole we are faced with. It's not one specific area that's suffering more so than others. This is an overall general problem. Information was obtained from the kids inpatient database. Now, this database is a specific database that is nationally representative sample of discharge data from acute care hospitalizations of children and adolescents younger than 21 years of age. So through this quantitative research that I had done, I chose an article that was based off of this, and I reviewed the information that was presented. And through the evidence, it was proven that it is a current problem, and that there's implementations that need to be played into society, especially with the education through children's hunting, and parents needing to further their education with their children within the guns. The next is the patient-client centered care. The learning outcome was employ safe, effective patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intra-professional healthcare team. I felt that this was obtained in the Nurses 4321 Nursing Theories class. The assignments was the APA paper, which I chose, and did the ethical dilemmas, and then the health history and assessment, which I had previously taken that in the program. I felt that the goal met was 100%. The ethical dilemma that I encountered was one of my patients had wanted to express their own autonomy, and the physician was basically insisting that he wanted to continue, whereas the patient did not. Ultimately, it was the patient's choice, and I acted as a nursing advocate for the patient and the family and ensured that the patient's voice was heard and that the physician and the team did not overtrump the patient. I was prepared to take it to the ethical board. However, through consults with other physicians, the physician obliged to the patient's demands, and the patient was given the right of autonomy. The next one is professional roles. Differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients' clients as a member of the interprofessional and intraprofessional healthcare team. I felt that this was obtained in the Nursing Practice Leadership and Management class, Nurses 4550, and the Nursing Theories class as well. I did the Identifying Effective Leadership paper and the APA paper, Ethical Dilemmas, as my assignments. I felt that the goal was met 100% as well. One thing that I would like to highlight was with the Effective Leadership paper, the various styles of leadership was interesting to me because you do encounter different managers and they do have different styles. And Lewin's 3 styles that kind of a manager kind of falls into is either the autocratic, which is the authoritarian leadership, which it's basically their way or no way. They're going to be in control and tell everyone what their role is, what they need to do, and there's not really a place for anyone's opinion. The democratic, which is a precipitative leadership style, this is where your manager has the ultimate say, but the manager also listens to your concerns and your suggestions as well, and kind of researches it, goes over it, and see what is best for your unit as a whole. Then you have your laissez-faire, which is your delegative leadership. This is basically where your manager just kind of sits back, kind of relaxes, and delegates who needs to do what. If a decision's needing to be made, they might say, oh, well, go and ask Kathy. We'll let her make that decision. Instead of saying, okay, tell me what's going on. Let's try this way. Or this is what you need to do. So this was interesting because I was able to look at my managers and kind of base my managers and their personality off of what their style of their leadership was. The next one is the professional roles as well. The learning outcome was demonstrates professional integrity, effective communication, active inquiry, and service to the community. I felt that this one was obtained 100% through the Care of the Communities class, Nurses 4540. And I felt that I reached this goal through my practicum teaching project. The sticker that I had placed on here, you'll notice right here, it's the NURS. And basically it describes a nurse. So you smile, you're a caregiver, you're a professional, you're a therapist, you work in any other setting, you're friendly, you're a healer. And this is how others see nurses, but also how we see ourselves. So my teaching project that I had worked on and presented was I taught how to properly prepare for a natural disaster, especially a hurricane. I live in Southeast Texas, and we are the blunt force of hurricanes, as well as other coastline towns and states. Recently, we had the hurricane last year, Harvey, and he devastated a lot of our towns and communities. So I felt that it was the proper place to put information together and ensure that not only myself, but others, especially in my class, and people that I'd sent the presentation to, that they forwarded to their friends as well. And it taught them things that they need, supply list, how to have a emergency route plan, when the proper time is to leave, how to properly store things, and kind of like a guideline and a list, just a resource. And I felt that I reached that goal 100%. Now, if you would have asked me a couple of years back what my 5-year plan was, it was just to make it through. Well, today, as I sit here, and I'm just in shock that I finally made it, and I feel like I've taught not only myself that I can do anything that I put my mind to, but I've taught my children. And I upheld a promise to my dad that I would finish with my bachelor's and that I would continue moving forward, just like my sister did and my grandmother did, and it kind of runs deep in my blood. I encountered problems and complications along the road, but one thing that always held through was my faith and my determination to become a nurse. So my 5-year plan that I'm going to present to you is within these 5 years, I want to enroll at UT Tyler for my dual master's or my nurse practitioner. And from that point, I want to obtain my dual master's degree in nursing. I want to branch out into a managerial role within the company I currently work for, or if that's not an option, I would like to advance within another company. Possibilities are endless. Also, and if I choose not to go into the manager role, I have that to fall back on, which is the education role. So I could always move into the education role if the opportunity arose, which would be amazing because in the long run, I would want to become a teacher to give back to what so many educators have given to me, the wealth of knowledge and the love and passion for nursing. In conclusion, these are my references. I want to thank you for your time, and I hope that you've enjoyed my presentation, and I hope you have a blessed night. Thank you.